Good afternoon, everybody. Thank you so much for being here. Kate and I are just overjoyed to have the opportunity to share this time with you and to share some information that we hope will help you in your work with youth. We definitely know that depression is something that is prevalent among not only adolescents, but among children, adolescents, and certainly the young adults that are college age. And so we want to focus on how do we identify this early, how do we help them if they're struggling with it, how can we think about preventing it when they're not yet struggling with it. So thank you for your time, and we hope that this will be something that will be useful in your work. Just a brief note, we do understand that talking about depression and suicide is quite a sensitive matter. And talking about these things is very likely to affect all of us, either directly or indirectly. And if you feel like you want a little bit more of our time individually later to talk about that, we'd be delighted to see you after the program. Thank you.
So I think it's evident from the numbers in this room today that we are talking about a very serious problem. There is certainly no shortage of concerning statistics around the numbers of our youth who are struggling with depression and suicide and other mental illnesses. But just to bring it into this room for a minute, if you wouldn't mind, by a show of hands, how many of you have worked with a youth or are concerned about a youth who you know might be struggling from depression or some sort of a mental illness? So that's almost every hand in this room. And I think to expect us to cover this topic in 50 minutes this afternoon is unrealistic. But what Nadja and I are hoping is that today we're starting a conversation. We're talking about some things that you may or may not know about depression and suicide, and hopefully offering you some tools to use in your work with youth. But we hope it also is the beginning of a dialogue in your congregations, in your communities, with your colleagues, and with the youth that you're concerned about, so that we can really start addressing this issue. Some reports tell us that 60 to 80% of youth struggling from depression go undiagnosed and untreated. And you have a unique gatekeeping role in helping us find these children and make sure they get the help they need. So again, thank you for being here today.
So one of the questions that we hear the most is, why is it that so many kids are struggling with depression? Why are the rates so high? Why are kids struggling? What is it that's really bringing these young children and adolescents to struggle with such intense emotions? And a long time ago, the field used to think that there was one particular reason that caused it. It must have been one tragic event or one traumatic experience. And now we know enough about the illness to understand that it's really far more complex than that. And it really follows what we call a biopsychosocial model, meaning, as you can see from the figures here, there's a bit of a component that comes from the biology of it. So, for example, we know that depression is highly heritable, and that if one or both parents struggle with depression, there's a much higher risk of a child developing depression. We also know that from a social perspective, there are a lot of risk factors that can lead to depression. And those include things that might happen in the community, include things that happen in the home, any sort of trauma, divorce, things like that. From a psychological perspective, we know that kids that have a very limited repertoire of coping skills, or those that really don't have anyone to talk to, the kids that really are most frail inside themselves are the ones that really struggle. And finally, from a spiritual perspective. And I think that is actually one of the pieces that gets out of the medical model that is left out most often. But I think it's important for us to understand that when we're thinking about how to enhance the quality of their well-being or how to promote resilience, we need to take a look at the spiritual component as well. If we review the literature, it says that having a connection to a higher purpose and really having a sense of faith is important and actually protects protects kids from emotional distress. So we'd like to incorporate that into our definition of how we're addressing mental health and well-being.
So as I said, one of the reasons that we're excited to be here talking with you all today is because we think of youth workers as sort of the frontline gatekeepers for sometimes being the first people to see symptoms in youth. A lot of times we see adolescents in their typical environments, putting up walls and protective factors where you don't see the symptoms. So when they go to their sports practices or they're spending time with their friends or they're in school, people may not notice the blips in their mood or sadness or anger, irritability, some of the other symptoms we see with depression. And yet in your unique relationship with youth, and potentially in your youth groups where you've already established a loving, non-judgmental community, the kids might have an opportunity to let down some of their guard. And that's when you might notice some mood changes or behavior changes, and therefore might be the first person or people in their lives to recognize that they're struggling and be able to offer some support. For most, not all, but most adolescents, talking about their struggles and talking about depression can be very scary. They may be getting the message from society or their families or their peers that there's a stigma around mental illness and depression, and it takes a lot of courage to share some of the struggles. And so in order for them to ask for help, they have to already be in a trusting relationship. And as ministers and as youth leaders, we hope that you already have these relationships with the individuals. I know when I was running youth programs down in New Canaan, a lot of times it was the kids themselves coming to me saying they were struggling, but as often it was their friends who would come to me and say, I'm worried about my friend, I'm worried about my parent, I'm worried about my sibling, because they trusted you. And so sometimes that is your avenue into working with and helping identify youth who are struggling. I don't know how many of you have read the recent research by Lisa Miller. She's a contributing scholar through YMI, and she is looking at the co-occurrence, the developmental co-occurrence between a spiritual awakening and adolescence. And this makes a lot of sense. We understand that this is a time when they are looking to more future-oriented thinking, and they're tackling some really big questions in their lives. I know I was working with a youth last year whose negative thinking, which we'll come back to in a minute, really centered a lot around what was the meaning of life and what role did his faith play in his future. What was heaven all about? Was he ever going to get there? And so again, you are uniquely positioned in their lives to help them address some of these questions and to listen and to guide them through sort of this time in their lives where both of these things might be coming up at the same time. And then this is when we also get to tell you that you already have the skill sets you need to help youth who are suffering. We hear a lot concerns from people who say they don't know what to do, they don't know how to help, they're worried that they don't know what to say or how to say it. But your experience in your training in ministering to anybody who is suffering has already set you up with the unique skills that you need to work with a youth who is suffering. So your compassion and your ability to listen and to guide and to love these youth is exactly what you need to be walking alongside of them through this part of their lives.
So another very popular question that we often hear is, well, how do I know if I'm looking at something that's stress-related? Because I'm sure that a lot of the kids that you work with will tell you that they're stressed. How are you today? I'm stressed. Even very little ones will tell you right from the beginning, I'm so stressed out. And that has become their catch-all phrase for really conveying that they're struggling in a lot of different domains. And so one of the things that we really want to help them with is expand that range of vocabulary so that they're not saying that they're just stressed or that they're saying that they're depressed, because that's another word that they use a bit loosely. So part of the walking with them, as Kate said, on their journey is helping them to understand, how is it that you're feeling? What is distressing for you right now? And is that something that's related to something typical? Is it related to a particular situation? Or is this something that's related more to a mental illness, in which case our approach would be a bit different? So I often like to use this graph to show to kids to say that, typical changes in mood, they go up and down a little bit. If you think about the course of your own day, there are times when you feel better, and there are times, usually around 3 o'clock in the afternoon when you're not feeling so great, you need some coffee. You have a little dip, but then you go back up. And those slight fluctuations are absolutely normal and typical, certainly for adolescents. However, if you see this kind of decline, that is not typical. And that's really important for them to know, because there is a very strong myth out there that says adolescents are supposed to be moody. Adolescents are supposed to be suffering, and that is not the case. They're not. So it's important for them to understand, is this a situation that feels much more pervasive, right? Usually when we're taking a look at the green line, those dips are in relationship to something that's transient. Maybe they're really feeling overwhelmed because they have a lot of tests to complete, or they're in the middle of finals. And once those things are done, their mood goes back up. But when you're looking at the red line, despite interventions, despite supports being put in place, despite people trying to help out, the internal experience of the youth is that things remain very low, and it's very hard to rally back up again and to experience pleasure and joy in things that they used to before. One of the things to really note when we're talking about clinical depression are that all of the symptoms are too intense, they last too long, and they're too much for the person to handle on his or her own. As a rule of thumb, whenever somebody's really struggling for about 2 weeks or longer is when I would say that's a really good time to start thinking about what else is going on. Could this be something a little bit more than just stress? The other piece is that adolescents often hear the message, well, you pull yourself up by your bootstraps and you kind of keep going, or you're supposed to be able to handle things. And when they're faced with that message, it's really hard for them to admit that they're struggling. So an important thing to ask them is, what else have you tried? Or what else has been going on? How does that feel like that's working for you? If you start hearing, nothing's really working, things aren't going so well, things are going really hard, that's another piece to really be listening to.
So this is a chart that is probably a little bit more clinical. It's a helpful way for us to look at the different symptoms and what categories they fall into. So we're not worried about you looking at the words on the left so much as looking at the symptoms that are on the right. Some of the things that you might hear, as Nadja already mentioned, youth saying, they are not sleeping, or they're sleeping all the time. They're bored. They might talk about being stressed. You might hear them talking about having no friends. Things are never going to get better. There's nothing they can do. That's sort of the hopelessness and helplessness that comes along with some of these symptoms. The things that you're going to hear them saying fall into that last category, a lot of negative thinking. They get caught in a cycle where nothing is going to help. And so you'll hear that. You'll hear them talking about those things. And then you might notice some behavior changes, things that they're actually doing or not doing. So, for example, dropping out of activities that they normally loved. Maybe that's the youth program, or it's their sports, or it's hanging out with their friends. They're alone on Friday and Saturday nights, or whatever is different maybe from their typical social life. You might see them being irritable, snappy with their friends. You might see them socially isolating. For some, you might see them engaging in risky behaviors. There's a high co-occurrence with substance use and abuse with depression. So That could be, drinking, experimenting with drugs, other risky behaviors that you're seeing. So again, not looking so much at whether or not it's effective or somatic, but really looking at what are they doing and what are they saying, especially that's different from what you're normally used to seeing them do or say.
So the symptoms that Kate just shared with you are actually ones that are pretty uniform for kids who are struggling with depressive disorders. However, there tends to be a developmental progression where you see a cluster of symptoms that happens more for the younger kids. So roughly 10 to 14-year-olds, they experience the mood disorder along with a lot of anxiety-related symptoms. So for example, they might share a lot of worries with you. They might say, I can't come to the meeting today because I'm really worried about Mom. She has to drive and I worry about her car breaking down. Or I'm worried about my sister. They might also experience a lot of fears or even separation anxieties that happen. Sometimes kids that are prone to anxiety disorders might have had separation anxiety as little ones, and sometimes this comes back around middle school age. They also will experience and report to you a lot of physical symptoms, a lot of headaches, typically a lot of stomach aches, a lot of GI distress, saying that they don't feel well, that they feel tired, that they feel like they're run down or feel exhausted. And I should mention that these feelings are actually not made up. They truly do have a much lower threshold for pain, and because they're so distressed, they actually also have a lower tolerance for illnesses, so they might become ill more frequently. Older adolescents begin to experience their disorder in slightly a different way. As they really start struggling and grasping more abstract concepts, they start thinking about their own sense of being in the context of everything else. This is when you start hearing more of the negative thoughts about themselves, feeling incompetent or unworthy, or maybe they feel like they're the cause of distress for the people around them. This is also the point where we actually hear more talk about thoughts of death or potentially suicide. And it's not actually, sadly, it's not uncommon that you might hear this in the younger kids too, but it's really right around that 13-year-old time frame when things seem to take a pretty significant shift. I don't know how many of you work with 8th graders, but 8th grade is a really hard year, and they really start to experience things in a very different way. One of the things I want to mention is that a lot of these symptoms, they feel internally, and there are some kids that actually are high achievers, they do really well, and they can put up a bit of a defense or a bit of a wall when they're in school. And so it might feel confusing for parents or for teachers to say, she's functioning perfectly well in my classroom, I don't understand what you're talking about. But they're not able to sustain that for very long. So typically after the school day is over, they get home and they kind of crash because they're so exhausted from having to keep this up. Similarly, as Kate was mentioning, when they're with you and they feel like they're in a safe spot, that might be when they allow themselves to be a bit more vulnerable. So I think in addition to asking about physical symptoms or somatic symptoms, asking about what their thoughts are and what their internal experience during that time of, more intimacy that you have with them is really important in order to get a sense of both their external and internal experiences. There we go. Sorry, Kate, they're sticking together.
So when we get to this slide, people tend to get nervous, but the reason that we talk about depression and suicide together is not because everyone who suffers from depression is going to be or feel suicidal. I think that's really important to understand. But we do know that individuals who have suicidal thoughts or behaviors or who have died by suicide typically have experienced or were experiencing a depression. And so we talk about these things together because we want to understand that depression is a risk factor for suicidality.
So I think another piece that we really want to make sure that we emphasize to you is we are not expecting by any means any of you to begin to diagnose kids or to feel like you have to treat them in a clinical way. And that's really important because I know that for people who are not in the mental health clinician, part of the worry might be, what do I say? What do I do? Or what's the right thing to do? So what we'd like to share with you are actually some behaviors that you can look for. And so rather than asking you to make an assessment about the level of risk, what we're asking you to do is to notice these things, because these are the things that have been shown in the literature, the behaviors that tend to happen either days, hours, or even minutes before someone has a suicidal gesture. And these are very different. I'm sure that you've heard about things like risk factors for suicide. Those are things that might be in somebody's history, like a completed suicide in the family, and you might not be privy to any of that information, so it's hard for you to determine what the family level risk is. But you are able, when you have the people in front of you, to see changes in behavior, and these are the things that we urge you to be mindful of to help you understand whether a particular child might be at risk. One of the important things to note for are whether there are any preoccupations with death-related topics or even any direct talks about suicide. You know, a lot of times kids might be impulsive or frustrated or feeling in a moment of humiliation. They might say, I wish I was dead. And although at that moment we might think, well, that was said in a bit of haste, I don't think that's actually the intent. I really encourage you to follow that comment up very seriously, because in addition to the follow-up, the message that we want to send that child, as well as the broader group of kids, is, you know, this is really important. And if you're feeling like you're in that much distress, whether you're actually thinking about dying or not, it means a lot to me, and I really want to help. So the response and the message that that response conveys is very important. Another thing to take a look at is, are kids sort of saying goodbye in their own way to you or to their loved ones, or kind of giving things away? There was somebody that I actually worked with, and her boyfriend started calling her and saying, you know, you've been such a great girlfriend, and I'm really, really so lucky to have had you. And I put together an album with all of our pictures and all of our things, and I want you to have this. Now, you might say, okay, well, that's not really saying goodbye, right? That's something that people might do. But in the context of a lot of distress, a lot of sadness, and a lot of hurt for him, that's the kind of thing that you want to follow up in terms of what is the intent of giving that? Are you saying goodbye? Or what's happening behind that gesture? And there are other things in here for sure. I think if you notice any significant changes, something that is out of character for the child, you know, let's say that you had someone that was very gregarious and engaged with other people, really liked to help, and all of a sudden becomes very withdrawn. Or maybe you had somebody who was very quiet and kind of even, and all of a sudden becomes quite reckless. Any extreme change in personality and behavior is important to note. And then, of course, getting means of any kind. So getting weapons or getting pills or getting anything that could potentially be lethal. All of those things, certainly one of those behaviors merits follow-up, but a combination of those things, it's really important to follow very quickly and aggressively.
So from the hands raised when we first started, I know that I'm not telling you anything you don't already know, that youth who are suffering from depression are feeling this very deeply and very profoundly. And they're often feeling very helpless and very hopeless, like things are not going to get better. And a lot of times the people in their lives, their parents, their ministers, their friends, start to feel the same way. They don't know what to do. They don't know how to help, and that's scary. So we're going to shift a little bit now and talk to you a little bit about what are some of the things that you can do. What are some of the tools that you can have now that you know a little bit more potentially, and how can you help when they are feeling like nothing else is going to help.
Okay, so we want to reassure you that clinical training is not a necessity in order to be able to respond effectively to a youth that's in crisis. And a lot, as Kate said, a lot of the skills and the approach that you already have can be actually very calming and grounding in a moment of crisis. So some of the things we don't want to we don't want to ignore or dismiss the issue. If somebody is talking about suicide or about death, we don't want to say, well, it actually will be okay, things will be all right, and I know it seems hard right now, but things will get better. I have to tell you, I'm a parent, and that's my first initial response with my kids when they tell me something. I always want to say, it's okay, it'll be fine. But actually what a person in crisis needs at that moment is not reassurance, but actually just someone who will hold that space and be able to tolerate the level of distress that they're feeling at the moment. The other thing is, of course, not acting shocked or embarrassed. You don't want to put the youth in a position where they feel like they now have to take care of you, or somehow that they minimize their experience because they're worried about how you might respond. We don't want to challenge or debate or bargain. Being in a suicidal crisis is very interesting because, the kids actually don't want to die. They want to live. It's just that they don't know what else to do to get rid of that emotional pain. So they're very aware of the fact that they have people who love them, or they're very aware of the fact that they have a lot to live for. But the fact that they can't experience that makes them feel even worse. So to hear, no, why would you do that? You have so many people who care for you, or, you have so much to live for, actually can be counterproductive to how they're feeling at the moment. And of course, promising to keep a secret. This is something that we really just cannot hold on to individually, and we really want to rely on our community to be able to help us through this component. There we go. Things to do. Showing that you care and are genuine and you want to listen. Being engaged, being non-judgmental, and like I said, just feeling like you can hold a space for them is critical. Asking questions directly. It can feel really uncomfortable and actually painful to say to a child, are you thinking about killing yourself? But it's actually really important to use the words directly and to ask them so you have a better understanding of what's going on. If they say yes, it's important to say, have you thought about how you might do that? So you have a sense of this is something that the child is thinking about imminently or has a pretty clear plan on. You don't want to leave him alone. It's very important that if you're at church, maybe you find somebody else to be with you, or if you're at a different location and you feel like there's nobody that you can call upon, you call 911 right away. And finally, get others involved immediately, not just in the immediate crisis, but also in the aftermath, because right after that time, after everything has happened and the acute supports have been put in place, people can then feel really isolated. There can be a sense of embarrassment or shame. So getting the community involved throughout the process after is really important.
One of the questions that people always ask is about confidentiality. This is particularly important to the role of youth ministers who do have that relationship of confidentiality with their youth and want to protect that relationship. When there is a crisis, we urge you to err on the side of caution. We don't expect anybody to be able to judge whether or not this child would act on what they're saying, but that's not something that you need to decide. So we ask that you be very transparent in your ability to keep confidential or not keep confidential what they're sharing with you, and really making that whole process very transparent. So letting the youth that you're working with know what phone calls you might need to make. If it's appropriate, maybe they are with you when you're making those phone calls to parents or to caregivers or even to 911. And if they're in a crisis, they're probably very afraid of what's going to happen next. So helping them to understand what might happen next. What are the steps that you're going to take what their parents might do, if this is a situation where you're calling 911, what the ambulance, when that comes, what's going to happen, and talking to parents in the same way, letting them know what is happening, what you have heard, and being very transparent about how you communicate that with the parents. One of the things that we recommend before a crisis is ever at your door, that you really understand the resources in your community. In the best case scenario, maybe you have engaged in a relationship with a clinician who's willing to be on call for crises, or who will help you make referrals or know how to take the next steps. Knowing what is in your community, emergency rooms, outpatient therapists. In Connecticut, I don't know if you're all familiar with 211 Mobile Crisis, who can come help assess the situation. But finding those resources and knowing them ahead of time so that if you are in a crisis with a youth, you already know what to do. Involving family and the youth in the referral process. If you are involved in that step, it's really important that they help participate in making those decisions, whether it be calling 911 or for a youth who's maybe not in a crisis, but who you've already worked with and know that they're struggling and they might need help and might be at a point where they're willing to talk to somebody and have a counselor involved. Having them be a part of what those services are going to be is going to be very important. And then this final one, self-care, I think is overlooked a lot of times, but it could be one of the most important things for you as an individual. You are not in this room because you don't love kids. And so if you are working with kids who are hurting, that is likely to affect you very deeply as well. And it is important for you to take care of yourself as you're taking care of other people. So that means having someone that you can talk to, someone that you can rely on and share your concerns or your worries or your experiences with the youth that you're concerned about is critical in being able to help the youth as you walk this journey with them.
So we've been talking to you a lot about clinical depression. We've been talking to you about moments of crisis. But you know, what happens the other times? What happens during the normal course of the day? And certainly what happens outside of that 1 hour of therapy a week that somebody might be getting. That time is actually quite important because what we know is that kids who fare best in terms of long-term outcomes are those that develop a set of coping skills that will help them on a daily basis. And this is where we want to share some of these coping skills with you so you can remind the youth that you work with that there are very little things that they can do every day to manage their mood. It doesn't have to be a huge, really complicated therapeutic intervention. It can be just finding those things that bring them pleasure, that bring them peace, and bring them calm on a daily basis. To know that feelings are okay to have an experience is critical. It's amazing how many kids feel that they can't express a lot of anger because it's unacceptable. You can't be that angry. Well, of course it's okay to be angry. It's just how you manage that anger that's important. Or of course it's okay to be really frustrated or angry or hurt or sad. All of those things are okay, but somehow kids feel like they're not able to have them or experience them. So letting them know, you know what, it's fine. It's okay for you to feel that way. Let's talk about how we're going to manage that. Taking an inventory of what their triggers are. We all have peculiar things that will set us off at different times, right? And so thinking about what traditionally has led you to a difficult behavior or a difficult experience, what supports can you put in place at that moment, and what are the strengths that you have that you're bringing into it? Kids will often fall into the pattern where they fall into the same situation and they keep making the same mistakes over and over, not because they want to, but because they haven't been given the instruction of how to evaluate a situation and how to understand it better. So that's something that you can help them with, certainly in terms of them identifying their strengths and their sources of support. Unbelievable, but how do you feel when you haven't slept? Cranky. I don't know, I get cranky. But we're getting kids that are up until 2 o'clock in the morning doing homework. They're waking up, at 6 o'clock in the morning to get up to go to school. They're not getting enough sleep. And so anything that you can do to remind them, please get a good amount of sleep. Sleep hygiene is critical for mood management. Mindfulness, prayer. What we know now about treatments that are effective for kids who are struggling with mood disorders is that anything that they can do to kind of quiet their mind a little bit or to be more internally reflective is incredibly helpful. Service to others, it's a huge protective factor. So feeling like you're doing something good for someone else. And certainly participating in positive youth development, and that can be in the context of your youth groups, right? Helping others, service trips, helping their peers who might be in need, just experiencing positive situations with each other. All of those things are protective factors that can help all kids, not just those struggling with depression, but all kids.
So this is just an extension of what Nadja's already started talking about in terms of coping, but we wanted you to be thinking about these things also, not just for your youth who you're concerned about, but for the larger group of kids or adolescents that you're working with, because we're looking at prevention too. Of course, we want to work with the kids who are already suffering, but there are a lot of things that we can do and things that we can model for kids who may not be showing any symptoms, but who could be at risk. And so things that you can do to help protect them. We know we've already talked about how difficult it can be for the youth to talk about what they're struggling with. So modeling and talking about the courage to talk about what's going on, whether that's sharing, when it's appropriate, your own experiences or experiences from, your past or other people you've worked with. Teaching them about compassion. So in the context of a youth program, kids talk. So if there is someone struggling, the other kids are likely to know about that. So teaching them about compassion and how to be a listener, how to help care for that individual, both modeling and then talking very directly about how to do that, especially when they're asking. Connection. So some of these are buzzwords that we put on here partly because this is what adolescents and youth who are struggling from depression are often lacking, all of these things. So connection to you, to others, to their family, to God, to their faith, whatever things that work for you, you can model and show them how you do that in your life. And then encourage the rest of the group or the rest of the people you're working with who maybe aren't in crisis. How can they show how they have connection? Hope is one of the things that these kids are missing probably the most. The darkness in the negative thinking is that it's never going to get better. And Nadja had mentioned earlier that it's not always helpful to tell them how good their life actually is if they could just see that, but offering hope that if it doesn't feel good right now, that doesn't mean it's always going to be that way, and that there is hope moving forward. And then faith, what role does that play in their life? How can they use their faith as a protective factor or as a lifesaver when they feel like they're drowning? And again, showing them how you do that in your life and how you do that in your faith and your journey. Or people who sharing those stories can be very, very powerful for them. And again, protective factors for both those who are struggling and those who you don't think are actually struggling at the time, but protecting them for the future.
So for those of you considering to work with kids that might be struggling with depression, or for those of you that want to take a more preventive approach in terms of teaching all of your kids and educating them about what depression is all about, there are already a number of resources out there. You don't have to feel like you have to put things together yourself. Kate and I had the pleasure of working together in developing a particular curriculum. So this is an example of a resource that's already available to you. It's called the Break Free from Depression curriculum. And one of the things that Kate and I did was we went to a lot of schools and we educated kids about the different symptoms of depression, how they could seek help for themselves or others. And they would say, well, thank you, that's very helpful, but can you bring someone who's actually struggling so that I can hear from a peer what it looks like, what it sounds like from someone my age? So we actually developed a documentary based on real-life stories, and so this is a curriculum that centers around a documentary depicting different presentations of adolescents and young adults struggling with depression. The other piece is that Kate, Skip, and I are actually talking right now about either using this resource or thinking about new ways to incorporate similar kinds of information to use in particular faith-based settings. So any ideas you might have or any suggestions would obviously be very welcome. And the next set of slides that we have in your packets have a number of additional resources, both at the national and at the local level, as Kate mentioned, for example, the 211 resource here in Connecticut, but also other websites, helplines, hotlines that you can access for more help. And the final slide includes so this is the one with websites, and this is the recommended readings. So as you continue to learn more about the topic, here are some that we think are particularly helpful. So thank you to all of you. We really very much appreciate your time and your interest in this very important topic. And I know that locally, there's a very helpful resource, actually, that you can access at the Yale Mental Health Center. So that's right here, something that can be of help. So thank you to all of you.
Thank you to Nadja, and thank you to my good friend Kate for a really wonderful presentation and their work they're doing. I do just want to lift one piece up that was at the end, and then we need to let you go because you need to go to classes, and we'll have Q&A for those who can stay. This question of how to bring this into youth ministry contexts is one of the centers of our mission and vision at the Youth Ministry Initiative. What we're trying to do is when a great organization like Children's Hospital Boston puts together a 5-year program that they vet and develop, obviously if they want it in the public schools, they pull out all the spiritual parts. But actually, faith in a loving God who will never leave you in a community that is connected to one another in that faith is maybe the most protective thing you can do. So we want to develop these resources that youth ministers can then bring into their own communities. And we're working on that in suicide, depression, eating disorders, violence, racism, poverty, alcoholism, and sexual behaviors. So this is part of the work we need to be doing together. Now, I know some of you need to leave, and we need to let you go to keep covenant with you. I'm very disappointed. There's a lot of food left, so